Welcome to the front row. We put you first. I'm Coach Cheryl Nolte, and this is Introduction to Hearing Challenges. I'm here to clue you in about hearing challenges because your ears function for your senses through their connection to your brain. Challenges like tinnitus, hearing loss, hyperacusis, and even balance issues require your ears and your brain to work together. When something goes wrong with any of these challenges, it can make listening and understanding feel overwhelming. That's why I created the front row captioned classes, now on video, to clue you in to ways to overcome and deal with these challenges. These valuable sessions we offer will empower you with information and knowledge, resources and education, plus advocacy to fit your needs. You'll get answers to many questions, including some you didn't even realize you had. From these easy to sign up sessions, you will learn what hearing challenges are and their causes and solutions, practical strategies for listening and managing your hearing loss, tinnitus, hyperacusis, and balance issues, tips for reducing listening fatigue, you know that happens, and improving your understanding skills. We will also clue you in to finding free and low-cost help for those hearing challenges. We'll help you decipher which of over 250 apps out there can best fit your needs. You will understand and learn how to adapt to hearing aids, and learning lip reading the Sherlock way will make it simpler, easier, and more fun to stay connected. In fact, 98% of our students learn more than they anticipated. With over 50 years of lip reading experience and more than 15 plus years as a hearing challenge advisor and advocate, I share practical advice, proven solutions, and helpful resources drawn from my own journey as I worked with hundreds of adults. After registering for a session, you can request the presentation slides and a list of valuable resources through our website's contact page or my email, speechreader2@gmail.com. We'll be happy to send them to you. In this front row, you're someone who matters, with challenges to deal with. That's why we put you first. Plus, you'll get more helpful clues and encouragement every step of the way. The more you learn, the more enhanced your life becomes. Our video classes will fit your schedule. Our lip reading course, Lip Reading like Sherlock, the simpler and easier way to learn, will enhance your communication and understanding skills. We also offer hearing challenge and tinnitus coaching for combo advice. You'll discover and implement insights through these classes. Save time, hassle, and money by becoming part of our front row where you are put first. Knowing these things will help others too. Are you ready to take your seat in the front row? Check out our website, www.hearingchallengecoach.com, to select from our new classes and register. Take charge of your hearing challenges and feel confident, connected, and empowered. Take your seat, get clued in, and discover how much more enjoyable your life can be. Let's get started. Now I'm going to list for you types of hearing challenges. With hearing loss, there's 4 types. The first one we'll talk about is conductive hearing loss, And that's when problems with the eardrum or bones within the ear can be an issue, not getting that sound through the ear to the brain as needed. Those can be caused by things like infection, earwax blockage, bone deterioration, osteoporosis, and more. Then there is sensorineural hearing loss, and that is when there's damage to the little cilia cells inside the cochlea caused by noise, drugs, and other things, chemical solvents, proboscisis, which is age, and even genetics. The mixed hearing loss category, which I fall into, is a combination of both bone conduction and sensorineural problems. And my mixed loss has only been in the last 4 or 5 years. Hidden hearing loss is the newest category, and it's typically attributed to your brain rather than your ears. The brain is not receiving the messages needed that the ears are trying to send. When you have a test, an auditory test, and it comes back normal, and yet you know you have problems, or others say you have problems, you probably have one of several types of hidden hearing loss. So now we'll talk about the next hearing challenge, tinnitus. And it's also referred to sometimes as ringing in the ears. The real hearing challenge is knowing that it's something you're hearing and others aren't. Often it's a precursor to hearing loss, and there's a separate information sheet available on tinnitus that I can send you upon request. I have a journal I've created with my journey through tinnitus. In fact, I'm writing a book about it because I've learned so much. Tinnitus is almost as individual as you are, almost as individual as your hearing loss is, just like a fingerprint. Then there are balance issues, vertigo, lightheadedness, loss of balance, dizziness. Of course, you've heard of motion sickness, and there are different types to be aware of. Our slides go into more detail on that. And I must tell you, part of my passion is saving tomorrow's hearing today, knowing what to do to protect the hearing you do have, and noise is the #1 preventable cause of hearing loss. So it can also trigger tinnitus and trigger headaches, but be aware that you have control over exposure to noise if you know about it and know what to do. We're going to talk next about causes of hearing challenges. We just discussed the types briefly. Now we're going to talk about what makes that happen. And I mentioned noise, and of course there's more information on that, but importantly you need to know if you're an adult, starting at 80, they say on CDC, 85 decibels, but I look at 80 because it can get to 85 so quickly. That decibel level can harm your hearing. So avoid noise that comes up that quickly between 80 to 85 decibels. Anything, even 3 to 5 minutes exposure of something over that level can be a problem, or long-term exposure of something close to that level can be a problem to you, and it might not show up right away. I will also tell you something very crucial right now to know. Your pets are affected by the loudness, and your children are affected by loudness, and their exposure level is different than the adult measure. Children are affected at levels as low as 70 decibels, and that is not measured like in inches where every inch is another inch. it's exponential, so worry about reaching from 70 and up faster than it would go from, say, 60 to 70. Protect your children's, your grandchildren's hearing, and that of your pets as well by avoiding noise. Use those earplugs, use those headphones that are protective, not just the ones that allow you to listen to music. Second category of the most preventable causes of hearing loss, and actually tinnitus as well, again, drugs and chemical solvents. I have handout sheets on that I can send you, but know that over-the-counter as well as prescribed drugs, there are categories that can really affect your hearing. Check for side effects. Every time a doctor prescribes, ask them. Check the side effects of your over-the-counter medicines and be cautious about it. Not everything is shown on those little bottles. Do research online if at all possible. Chemical solvents we'll talk about in a little bit, but know importantly, even bug sprays can be a problem. And know also that exposure doesn't come just through the ears, it comes through the nose and through the mouth and even through the eyes. Watch out for those side effects and keep yourself protected every way possible. Age is another cause of hearing loss. As we get older, our parts tend to fail a little bit, some faster than others. It's called also proboscis, so know that as well. Then we have trauma, which can be a problem, and that's of course when there's an injury to your ear area or the part of your brain that controls communication. That is important to know. So be protective. If you're a motorcycle rider or you're riding a bike, a helmet can help protect you that way. There are also other causes of hearing loss. Illness, especially in children where they get often ear infections or throat infections as well, can affect the hearing. Find out from your doctor what you can do to protect that hearing category and take advantage of that. We have more information, as I said, on the slides. This is something that you need to be aware of, what we're going to talk about next. And we mentioned side effects. A couple of really great resources to look at for protecting your hearing are WebMD and the Mayo Clinic and Cleveland Clinic as well. They have resources online where you can check certain drugs and chemical effects. Actually, worry about antibiotics, especially if they end in mycin, M-I-C-I-N. Check on chemotherapy drugs and radiation that can also create a problem. Even overuse of aspirin and NSAIDs, either repeatedly or too much at a time, can create an issue. There's loop diuretics, things to treat malaria, even erectile dysfunction drugs can create a problem for hearing. And I will tell you, I've had 2 experiences with acquaintances who personally have hearing loss due to anesthesia. One went back quickly after getting home, realizing that all of a sudden hearing was gone or very limited, called the doctor and went back in and got a shot, and it took care of a lot of the difference. Another wasn't aware of doing that and just thought it was temporary from inflammation or whatever, and lost a good part of their hearing because of the side effect of anesthesia. So ask if you're going into any kind of procedure, will this affect my hearing? There are other causes as well to be concerned with, and again, you can request the slide information if you wish to. We talked about chemical solvents for a moment, but I want to let you know that benzene, which is in plastic paints and other things, Carbon disulfide, which is in pesticides particularly, can create hearing loss. That's a side effect, and that comes in, as I said, not just through the ears, but through the nose, inhaled through the mouth, through orifices. Carbon monoxide, which comes from cigarette smoke, gas-powered tools, and more, can be an issue. Styrene, which is in plastics, insulating material, can be an issue. There is something called trichloroethylene, which is in paints and waxes and lubricants and rug cleaners and spot removers, can be an issue. Watch out for the side effects on those. Protect yourself. You can wear a mask. You can put earplugs in when you are using this. Toluene, which is in paints and lacquers and adhesives, rubber, leather, tanning, spray paint, all of those can be a problem. Possibly. Check the side effects. Protect yourself. Wear a mask. Wear earplugs. Check your side effects and learn what you can do to protect tomorrow's hearing today. Next, we'll talk about ways to help you with hearing challenges. For hearing loss, you've heard of hearing aids. Now they're even over the counter. You need to know how to shop for them, what to know, what to learn, and how to adapt to them. We have a class just for that purpose. It's a 1-hour session on the website. Check it out. It's very low cost, full of information. And it's not something that everyone out there has, understands, and uses, but needs to know. There's cochlear implant availability to people with severe or severe to profound or profound hearing loss. To qualify, it's not always covered by insurance, just like hearing aids are covered, sometimes up to a certain point. Be aware that you can find out about the manufacturers of cochlear implants if you qualify. There are 3, and there's different types of those. Some are better depending upon your individual needs with hearing loss. There is something called a BAHA, not related to California at all. It's Bone Assist Hearing Aid, and this is something that the FDA has approved 2 manufacturers for, and it helps those with bone conduction loss of some sort. For balance issues, there are causes that include vestibular neuritis, inflammatory disorder, there's postural perception issues, Meniere's disease. There's others that are listed on the slides, as I said. Know about those. Motion sickness is probably one you've heard the most about. You can find help, but first source for any hearing challenge should be your ear, nose, and throat doctor. Find out what you can, and they will investigate and run tests as needed for you. If you have hyperacusis, like I also have, there are 2 types and 4 categories of hyperacusis. And I thought it was just simply exposure to loud noise when I first had it, which is what I tend to respond with. There's vestibular hyperacusis as well, which is involved with also dizziness, imbalance reaction, and exposure to certain sounds, not just loud sounds. The 4 categories include loudness. If you were creating a journal or you're rating them somehow, you would rate the loudness, you would rate the annoyance factor, the fear factor, and the pain factor. Those are the 4 categories that they evaluate. Again, start with your ENT doctor for this. There's a great deal of information available to you through your ear, nose, and throat doctor. For tinnitus, the biggest help for me was not looking at what caused it to begin with, but what triggers it now. I had more than one trigger. I had more than one kind, actually. And you'd be surprised some of the causes they've discovered that create these problems where something sound-wise is coming in, and it's coming in from the brain, not from the ears. Get a hearing test if you have tinnitus. A great percentage of people with tinnitus also have hearing loss, often undiagnosed. There's more information available on the website and by checking out the slide. The HIPAA Act, by the way, allows you to get a copy of your hearing tests. There may be a small charge, but you are not required to buy something from that provider that did the testing to get the copy of the test, so know that. I suggest going to your ENT for tinnitus and for any hearing challenge, of course. And you're going to find that sometimes they suggest to you white noise, and there's even pink noise now. Ask about that. That can help with tinnitus. That can help with some other communicative disorders as well. So that's very interesting. And moving on, we're going to talk about types of help for tinnitus. Find out your triggers. I created a journal for this. For 2 weeks, kept track. Some people respond differently to foods, to smells, to sounds. There's other things going on that are making this happen in your head. Find out what those are. It can take a long time, and you may never find out what the original cause was, but you can find out what makes it worse or better. And I've learned a process to help with a number of the responses that I have, and I'm passing that along, as I said, in the book I'm working on. But you have the advantage of sending an email for more information, or use the contact page on the website. Get your hearing tested, as I suggested. Get to your ENT, and know that there is sometimes offered to you something called cognitive therapy. And this is where you learn to adapt to it. If they say get used to it, that may be what they're referring to. But there's so many other things that you can discover and do to make it a whole lot easier. That's not just cognitive therapy, but that can help. Acupuncture helps some people. In fact, it helped my husband with his tinnitus. And I say tinnitus, by the way, just like I say lip reading, because it's easier to read on the lips and it sounds clearer than if you say tinnitus or speech reading. So now you know that secret. Get regular medical checkups if you have any hearing challenge. You need a baseline for where you are and what's happening and how things might be correlated. And the only FDA-approved over-the-counter item for tinnitus is COQ10, which also helps other parts of your body as well. And I have found that personally to be somewhat helpful. Next, we're going to talk about my favorite topic, which is lip reading. And lip reading is so wonderful a skill. It's something that you learn just like you learn the alphabet, just like you learn your math and your chemical abbreviations. Lip reading, which is so helpful as a lifelong skill. I found that it is major as far as what I can learn and what I can do because I know how to lip read. And you don't have to be a certain age as long as you understand the vocabulary and you can learn. In fact, my oldest student was 97 and he did fine. Lip reading the Sherlock way is the way I now teach it. It's simpler, easier to learn. We look for clues. I will clue you in and I will show you the simple steps to get started Actually, we have an intro to lip reading class that's only $25 on the website, and it gets you started with some basics to see what you can learn. Lip reading, like Sherlock, is a great way to learn because it's easier, it's simpler. You learn what I call the big three through the funnel, and then you learn several basic nitty-gritty things. You way past many others that spend years trying to learn it. It does take practice, I will tell you. It takes commitment, but it is also fun. I love practicing with grandkids and children and others that are friends, and I teach them as they learn. It is effective, and it's something that lasts you all your life. It doesn't require batteries, and everybody has lips. And the World Health Organization now recognizes the value of the skill of lip reading and is promoting that. So you're not alone, remember, and you can be part of this world group that's discovering how great a skill it is. The earlier you start to learn, the easier it is for you when you absolutely need it. Teachers and nurses have been amazed at how helpful it is to them. So think about signing up. It works also great in noise or pretty much any atmosphere. Even at the beach, if you can lip read from a certain distance, it's so much easier. It looks good on a resume as well, and it will improve your life in ways you can't even imagine. Lip reading empowers the listener. It boosts your confidence. It reduces stress. My favorite benefit is less stress and frustration because I can confirm by reading those lips what I heard is what they said or isn't. And I learned how to read body language and facial expressions as well. You put those together for that whole speaker's side. It helps you capture those missing words. There's less judgment. There's no stigma for lip reading at all. It helps those around you, and you learn in the class all the ways that can happen. And there's potential that lip reading offers to fight against dementia, fall risks, and more. So give power back to the words. Consider taking that. One of my students said, I really use it all the time. I have about 30% word recognition. Find out your score when you get your test. Even if it's 80%, you still want that other 20%, right? And 80 is the average of hearing aids helping people understand words. She also said, I get about 30% word recognition with hearing aids, and lip reading is a huge help. The Sherlock way, as I mentioned, is easier and simpler to learn, and it guides you through communication challenges. I will tell you, captions are wonderful, but they are not always correct. And I have a page that lists various benefits that I can send you with the slides. My favorite, as I said, less stress and frustration. That's what you want. There are apps to help you out there, over 250, and you need to learn about which ones are best for your needs. There's apps for tinnitus, apps for listening to music that are better for those with hearing loss, and more. And you'll learn also what the difference is between a personal sound amplification product and a personal assistive listening device that helps you. And that difference is both a cost factor as well as how much it helps you. There's hundreds of different things available. They even make a stethoscope with a volume control now. And advocacy, I have to tell you, you can learn about how great a thing it is to put yourself there with your social contacts, not missing out, and understanding what is said. That happens when you advocate for yourself in the simple, easy ways. That includes saying, "Would you speak clearly for me? I appreciate it so much. I'm glad you can help." Let them know they can help you that way. They want to help, but you need to ask. I would be remiss if I didn't mention other possibilities. Sign language is a wonderful language. You can learn it. It does take practice. It takes time. I mentioned white noise and acupuncture and cognitive therapy already. So now I'm going to tell you there's a whole page and actually more of organizations that you can check out. They're created to help those with hearing challenges. The Hearing Loss Association of America is one of those. The American Tinnitus Association is another. There's a whole list of them that are great. This page has the link right on it that I send you. Some of my quotes have come through OSHA, have come through the CDC and other organizations that can give you data and statistics if you want to research that. Schedule a class. What's your next thing to do? What do you want to learn first? Or would you like a coaching session set up? In usually 2 coaching sessions, I can pinpoint exactly what you need for your specific hearing challenges instead of taking a bunch of other classes. You get the nitty-gritty right away. We offer lip reading classes, we offer apps class, we have advocacy and low-cost help session, which is also free like this one. And their new one is adapting to hearing aids, with people buying over the counter these days and providers not having as much time as they wish they had to answer all your questions and tell you what you need to know. That class is just amazing. I will suggest that you go to the website and sign up for those things that you want. This list is put together referring to some names as a help for you. I receive no remuneration or association with them. I simply recommend and give you choices. So I want to thank you for listening and invite you to our front row, and I hope to see you soon.